Microneedling, I did research some myths. So I thought this was kind of interesting. Some of the myths out there when it comes to microneedling. So people think it's painful, it can cause scarring. People think that there's a lot of downtime, that there's going to be blood involved, and they think that they can get the same results at home. So, first of all, before we get into all of that, why don't you introduce yourself? So who are you?
Who am I? I'm Kaylin. I go by Kay though. Everybody calls me Kay in the office. I've been at Misha for almost 5 years, but I've been an esthetician for 10 years. So this is my second home, the second med spa I've been at. I really love to do corrective treatments, peels. BBL Moxie is my current favorite, but also microneedling and laser hair removal was also near and dear to me because it's really where I started my aesthetic career, but I love to do all things.
Perfect. Well, I love that. And I was so excited for today's podcast because I work at the Reading office, but like Kay said, she works in the Allentown office. So I thought that was pretty exciting. We are going to talk to a bunch of the different providers at all of the different offices. For those that don't know, so Misha Aesthetics now has 5 offices. So we have the Allentown office, the Warminster, Philly, Reading, and then the newest, the Wellness Center. So let's get back to microneedling. So before we dive into actually what microneedling is, let's talk about a trend that we don't like. So what is a trend out there that a lot of people think they can do at home, but really they're doing more disservice than service to their skin?
I mean, just at home microneedling, like you mentioned, with those derma rollers or microneedling devices you can get off of like Temu really skeeve me out. You could do a ton of damage to your skin, especially with the rollers. We don't know our own pressure, so you don't know if you're really tearing apart the skin. And if you put your skin under a microscope, there's been studies done that you can actually damage the skin and the tissue versus making it better. It's also hard to keep the needles sharp if you're using the same needles. That's really gross. And also the depth. I mean, what are you getting? A 0.5 depth, which is okay for some areas, maybe like around the eyes. But if you really want to stimulate that collagen, you have to, make sure you're getting in the reticular dermis. And that's where your collagen lies. And for some areas like the neck or the jowls or the cheeks, I really like to get up to about 2.5 millimeters deep. And your at-home pen cannot do that.
And is there really a way to even keep that clean? That,
I
yeah.
don't, I don't think so. I think that's gross. I mean, and a lot of people are probably keeping it, on their counters. And we've seen, when you flush your toilet and you turn on the black light and they show where everything goes, like even your toothbrush, like it's disgusting. So
That sounds gross.
I can imagine
Toilet particles
microneedling.
just floating in the air.
Yeah. Or like microneedling your feces particles into your
Oh,
skin.
yeah, no,
Like, I
no,
know, gross. I
no,
can't.
no, yeah.
Nurse Kristen is somewhere right now, probably
She
like
is.
crawling in her
Yeah.
skin.
And she's actually just next door. So I'm sure she's just crawling in her skin. Yeah. Yeah. No, no. At the end of the day, it is just better to schedule a microneedling appointment. So here at Misha Aesthetics, we use the skin pen. So you kind of touched on this a little bit. With the skin pen, you can change the different depths that you're using. Plus, again, you're changing the needle for every client.
Absolutely.
Yeah, so why don't you talk a little bit about the skin pen?
So the skin pen is an FDA approved pen. It's been around on the market for a little bit. Each client comes in and they get their own special skin pen kit, which has a cartridge of the fine gauge needles, which is wrapped in its own sanitary paper. You get the skin pen condom, I call it, which is basically a wrap that you put on the skin pen so it protects it. And then it also gets sanitized too, but then you also get your rescue gel, which is great to take home each time to ensure healing.
So would you say everyone is a candidate for microneedling, or are there specific people that you think should definitely schedule a microneedling appointment?
So I think it is for everybody except for more acne prone clients. You have to watch because you don't want to spread the bacteria and cause infection or more cystic acne. But there is a way around it. You know, I tell clients, why don't you come in? We'll talk about your skincare. We'll talk about maybe a hydrodermabrasion, like a diamond glow, a chemical peel. Let's get that acne under control. And then we can eventually microneedle you. It's kind of like kindergarten graduation.
Yeah.
It's fun. You got to go through the process, but we can
Right.
get there.
You can always revisit it.
Right.
Would you say, so what are the benefits of getting microneedling done? I know we brought up Kristen, and like I said, she's just next door, but I love hearing her description of the aerating a lot. She uses that a lot. So what are the benefits of microneedling?
So the main benefit of microneedling is natural collagen production. So the process of microneedling is that we're stimulating micronized injuries in the skin, kind of like that aeration that she's talking about. And our skin's natural response is to heal and rebuild. So we're kind of breaking it down, causing a little inflammation so our skin builds back up. So those tiny, tiny little injuries, is where we're creating collagen. So it's great for fine lines, wrinkles, textures, the appearance of pores, depending what kind of glide or what we're pushing into the skin. It can help with pigmentation. So really refining the skin. So if you are spending the money to get Botox and filler, or if you have a non-acne face, you should be getting microneedling.
And like you said, there are different things that you can add to the appointment with microneedling. So microneedling starts out at 285, but then there are different things that you can add. You can add boosters, you can add exosomes, and I know you're really liking the using the exosomes with the microneedling.
Yeah, so there's different levels. Like I know we've been doing PRP for years. Everybody knows about the platelet-rich plasma, which is basically us drawing our own blood, spinning it, separating the white blood cells, and microneedling it back into the skin. But now the new thing is that we're finding that that might not be super effective for everybody. We're decreasing collagen at least 1 to 2% every year by the age between 20 and 25. So, say if I have a 60-year-old patient that's coming in for microneedling, is her platelets as quite effective as maybe somebody who's 25? Most likely not. So, we have these kind of bio growth factors that are created that are, more effective sometimes than our body's own production of the platelets. So there's a lot of stem cells in it, bone marrow growth factor. They're very, very specific about the filtration system for them, which I could probably talk about 3 podcasts about, but
But it is
time for that.
definitely a newer, right? It is kind of advancing from, like you said, the PRP microneedling that used to be really the only, option other than regular microneedling. And now there are so many other options. And it's
Yeah.
not something that when you schedule an appointment, you don't have to know exactly what you're looking for. You can schedule the regular microneedling appointment, and then we can always add on those boosters and everything at the appointment when you actually talk with the esthetician to see which one would be best for you, because there are so many different boosters.
Yeah, there are. Depending if you want to go for brightening, there's
Yeah.
the anti-age, the brightener solution, and it really, really helps. Your cells knock on the door and say, "Hello, wake up, let's get going, let's speed up this healing process." So, a lot of my clients that are worried about being red post microneedling, lasers,
Yeah.
this is a nice way to say, "Let's go. We don't have time for this.
Mhm.
Let's support the collagen and speed up this healing."
So when it comes to microneedling, would you say it's a once and done treatment, or how many treatments would you recommend to start? And then from there, what would you say to kind of continue on with the treatment?
Yeah, that's a great question. Sadly, we're always aging, we're always losing collagen. So, one treatment is never really a great option. I would say start with a series of 3 to 4 sessions. about 4 to 6 weeks apart. But it really depends what your goals are too. If we're fighting some deep acne scarring or very deep, static lines, we're definitely going to have to go for more.
And an option that we have here at Misha Aesthetics, we do offer with our Misha Plus rewards program, we do have different memberships, and one of them does highlight microneedling, in which a lot of clients do just so that they know they can stay on top of getting those 3 treatments. But if you want to go the membership route, there's also a microneedling package as well. So there are different things that you can do to help invest in this, because like you said, it's not a once and done treatment, and definitely starting off with those 3 appointments, and it would be 1 treatment every 4 to 6 weeks to start till you get through your first 3.
Yeah, and then I mean, we always revisit, and I'm sure all the other estheticians are like this too, but this is really a journey and we're here for it. So every appointment truly is a consultation over and over. Hey, how did you feel about your last treatment? Do you see change? Do you want to take a look at your befores and afters? Do you want to try something else? So, skincare is not one size fits all. And even though I've been doing this for 10 years, the fun part about it is it's always different. Even though we come up with an initial plan, sometimes I'm like, let's throw a Moxie in there.
Yeah. Right. Something to change it
Fun.
up. Yeah. Yeah. Because
Yeah.
you don't have to do your 3 all in a row. You definitely can do a treatment in between. Like you said, there are so many options now, and everyone's skin is different. So when you come in, and I know you talked about the breakouts, you may have a breakout one month and you might be upset thinking that there's nothing that you can do then, but there are options. Instead of microneedling, then there's other options to do for that month, and then schedule your microneedling 4 to 6 weeks after that.
Yeah, exactly.
One of the myths that we highlighted on at the beginning was, does microneedling hurt? So what do we use here at Misha Aesthetics to help with that?
So microneedling can hurt if you're not using the correct numbing cream. I've had clients come from other practices where either they didn't numb, which floored me, or they probably didn't use great numbing cream, so they felt it. But we always use prescription lidocaine tetracaine cream, and that really takes the edge off the needling. In my 10 years, I've never had anybody said, stop, I can't do this.
Right.
So really the numbing cream is everything, and sometimes how long you leave it on for.
Is there anything to keep in mind for someone that is thinking after they listen to this that they'd like to schedule a microneedling appointment? Is there anything that they need to think about before they come in? And then what does post-treatment look like?
Usually there's nothing they really need to think about before they come in. Again, I always, do the consultation first. Even if it's an experienced client that has done other things, I always sit them down in not my medical chair table, but my chair in the corner and say, hey, let's chat first. Let's make sure that this is the right treatment for you. You know what you're doing. So we kind of do that together. But obviously, I don't want them to go get, Botox yesterday by Michelle and then come in and get microneedling from me, because you really need about 2 weeks or so. And that's the beauty of Misha, is that we all work together. We can all see your notes and charts. Michelle's always one text away. So is Kristen. So is everybody else. Hey, I have your client here. What's the best? How can we pair their treatments? What can we do?
Is there any skincare products that clients should stop before getting microneedling?
I mean, possibly like if they're on a heavy tretinoin cream,
Okay.
or like a heavy retinol that's going to make them peel or make their skin very sensitive, I'd say give that a couple days. But that's pretty much it. You obviously don't want to microneedle over active sunburn either. I know we're going to be getting into the warmer months, so I'd say no to that. But you can still microneedle in the summer, but there's a little bit more restrictions, and I always sit down and talk to people about that.
And then for someone who's thinking, I know there's so many pictures out there on the internet of people that have had microneedling done where their face is all bloody and they're like, it looks like they have a terrible sunburn on their face. Like, what should people think about, if they're thinking about what kind of downtime should I expect in regards to, planning if they have an upcoming event coming up or a vacation coming up, or how, when should someone schedule their treatment before anything like that?
Yeah, I mean, you are going to be red when you leave your session. Like it's going to feel like a mild sunburn, red to pink skin. It also depends on your Fitzpatrick skin type. So obviously, the darker you are, the less red you'll see. But Ashley and I are super fair
You know?
pasties.
Yes.
So we leave pretty red, but you
Yes.
should not have blood on your face. I think we see those pictures, the famous Kim K getting
Oh, yeah.
microneedled and she's super bloody. That gets wiped off. But again, a little bit of pinpoint bleeding in office when I'm doing it is really great to see. It's a sign of a good treatment, but that gets wiped off. So you just look red and sunburnt for a couple days. And then your skin sometimes gets dry, not everybody. So I tell people to look out for that. And sometimes it honestly gets a little dull looking. And you're like, why did I microneedle? This is stupid. My skin doesn't look better. But I promise you, give it about a week. And then your skin starts looking a little smoother, a little glowier. Your tinted sunscreen or makeup, settles really nice. And you're like, okay, I get it. So
Yeah,
you
it's
really got
definitely
to.
trust the process.
Yeah, it's so hard too because I've been beating myself for 10 years also. And I wonder the same thing why I do this because I am my own worst client. But
Hmm.
yeah, it's
Yeah,
worth it.
because everyone is different, and that's the big thing. Just because your friend came in and she wasn't red at all, and then you come in and you go home and you're like, oh my gosh, what did I just do? I'm so red. Everyone is different, and that's just something to keep in mind. We're all different.
But that's where you add those growth factors, those
Yep.
exosomes to really help that
Yep.
speed up of the healing process. Now, every time I do a laser treatment or microneedling or RF microneedling, I'm always using either the anti-osh growth factor or the exosomes because I truly, truly believe in it.
So that's a good tie-in, because my next question was going to be, just because you're coming in for these treatments, you should then be going home. It doesn't mean then when you get home that you're not doing anything. So the big key really to any treatments that you have done is that your treatments plus using medical grade skincare is a huge connection. You're not, going to the dentist, or you know what I mean, like that tie-in that people always say, if you're eating cake, you're obviously not, you're going to eat the cake with the icing, so you want to pair them together. You're not just brushing your teeth, you brush your teeth and you go to the dentist and you pair them together. So that's exactly, something to keep in mind when you're coming in for your treatments. You want to also be using your medical grade skincare at home.
And it's an 80-20 rule. I say 80% what you do at home and sometimes 20% in office treatments,
Yep.
believe it or not. It's, like you said, it's like going to the gym all the time, but stopping at McDonald's after every time. I mean,
Yeah.
not the best choice.
Right. Right.
So, and I sit down with my clients and sometimes, I get it, it's a tough economy right now.
Right.
Groceries are insane. You have kids, Ashley, like
Yep.
we all do. It's
Yep.
wild. But if you are kind of have a budget, we have skincare across the board.
Oh,
Not everything is $300. So I love to sit down, keep it simple, ask you some lifestyle, routine things to help me build a special routine for you and your skin. And it can be done in pretty much every budget.
oh, for sure. And that's why we like to tie into when we were talking about the microneedling, remembering that, we have the Misha Plus rewards program. So you have options with packages, you have options with memberships as well to help you along that way. So to finish up for today, do you have a fun microneedling story of a client that you can remember? I'll give you a sec to think,
Oh my
because
God.
when I typed in, so in preparing for today, I typed in the history of microneedling and I was shocked. So a form of microneedling was used thousands of years ago as part of ancient Chinese medicine, which I almost fell off my chair when I read that. Like, to think that like the microneedling has been used in some form or fashion, for that length of time, it's just insane.
But it's so dope though to think like that, they weren't that far off. And a lot of my clients are really into like holistic things and,
Oh yeah.
that might not be ready for like Botox and injections yet. And, we
Yep.
support that. We get that. So they want to do things naturally. And microneedling is definitely a way to do things naturally. So
Yeah. Yeah, for sure. Um, so do you have a fun microneedling story that you can think of? Or
that's actually
maybe,
awful.
or
So,
even, do you remember the first time you got microneedling done?
okay, honestly, the first time I did it on my stomach after my daughter. She's now
Oh, well,
13.
see, there you go. And
But
but that's good though, because microneedling doesn't just have to be done on the face.
yeah, it can be done anywhere on the body. It really depends on the patient concern and what their goals and what they're looking to get. But we also have the RF microneedling too, which
Yeah.
is our Vivace. So I've actually been hitting my stomach with
Yep.
that as well because I'm trying to get summer ready after my son. He's almost 1, so it's time to get going again.
To get ready. All
Yeah,
right. Well, so that is a good point. The radio frequency microneedling. So we have the Vivace here, but I know like in Philly they have the Virtue. So that is going to be a topic definitely for a different day because I do like to tie that in and what the difference is between the skin pen and radio frequency microneedling. But with the skin pen, you can use that. It doesn't just have to be used on the face.
100%.
All right. Well, I had so much fun talking to you.
I know, and I never get to see you.
And that's what's so that's what was so fun about this. I am going to pick your brain about more topics in the future because I did have fun with this. I thought this was fun,
Yeah.
especially to tie in, like I said, Niche Aesthetics is such we have so many staff on hand at all the different offices, and we don't get to see each other very often. So it is exciting to pair together for this podcast journey that we are on.
Yes, thank you for having me. I miss you. I hope to see your face soon. And honestly, the last video you did for Instagram, the reel, that was freaking hysterical. I was dying. If anybody that really knows you would find it even funnier because it's just funny.
Well, thank you. All right. Well, until next episode, I hope everybody has a great day.
All right, guys, have a great weekend.
Bye.
Bye.